Hi, I'm now with Eva, who's the founder and leader of the Gemini Health School. Could you tell us about your big project?
Okay, thank you, Alvaro, for taking the video, first of all, and for hanging out with us. Gemini Healthcare Group, as you probably know, is a non-profit healthcare group that is established in the U.S. We have three main purposes. One is education of the Ethiopian physicians. Second one is providing services that do not exist by bringing in specialists to Ethiopia, not only to do the service but also to do the training. And the third is important. The project that we have, our goal is to build a pediatric or children's hospital in Ethiopia.
Darabo is an associate professor of pediatric surgery at the Addis Ababa University School of Medicine. He's also associate executive director of the College of Health Sciences. Thank you, Dr. Vidert, for hosting us. And also, I'm just going to ask you a few questions about what the challenges of the Addis Ababa University.
Thank you, Eva, actually, for helping us. You've been supporting us for the last several years. If I tell you the challenge of our hospital here are too many, but I would like to limit myself. Number one is, just to give you a background, Ethiopia is a population of primarily pediatric society. We have like 45% of the society out of 80 million is under the age of 15. So if you are talking about the health problem of the country, we are talking about children's health in Ethiopia. These are also very vulnerable groups, nutritionally, infectious disease, parasites, and everything, trauma, accidents. So they are vulnerable groups, are children for everything. So in Ethiopia, we have very limited pediatric service. There are now 4 pediatric surgeons in the country for 80 million population. And out of the 3 of them are working here, only one is working in a private practice. So why we are concentrated here now, it's a tactical approach. We are going to start fellowship program in Ethiopia. That's the only way out to solve the human resource need of the country. The main serious problem we have is human resource. We don't have pediatric surgery. Number 2, we are also flooded by a large number of patients. Pediatrics is also research consuming, expensive discipline, pediatric surgery. So it's also we always run out of shortage of consumable materials and also equipment as well. So if we address pediatrics problem in the country, or if we address surgical problems in the country, we are addressing surgical problem of the children. That should be the focus around it. Even in Black Line, from our study, it's 40% of the surgical activities is pediatric surgery. So we have 40% of the problems. But we have only 3 people compared to 45 surgeons working in the hospital. So it is a very serious issue. Human resource, materials, consumable materials, and also material like equipments like anesthesia machines, tables.
Where we are right now in terms of the third objectives is we have the land ready to build a 120-bed specialty pediatric hospital. We have the design ready, so it's almost ready to be built. God willing, if everything is in order, hopefully within the next 2 years, that's going to become operational.
And could you tell us more about Healing the Children?
Healing the Children is a non-profit organization. It's a national organization, but they have different chapters. The one that we partner with is with Desi here is Healing the Children Greater Philadelphia chapter. They're an NGO that is primarily working by doing medical mission work, by bringing doctors, not only in Africa, but also in Central and South America. So this is their first project in the U.S. In Ethiopia, sorry.
And what are your upcoming projects?
Well, what primarily we've been working on is based on the kits that we see. Most of these kids have the tracheostomy, which is a breathing tube. Without it, they would not survive. So, based on the needs, we've been bringing ENT or ear, nose, throat specialists who are better able to help train the residents, the local doctors, in managing their primary medical problems. And we're training the residents by bringing the ENT specialists. The other project that we're doing is working with urology, as you saw earlier, which is there's a lot of kidney and bladder and male and female genital problems. We're training the local doctors or helping educate them in handling those kind of issues. And also next week we have a pediatric CME or continuing medical education, which is very vital. Unfortunately, in the resource-limited countries, once the training is over, there's no facility or there's no system where they can continue to upgrade their education. So hopefully if we can establish an ongoing training facility, whether in live lectures where we bring in the doctors, or whether in internet-based or web-based continuing education, that's going to be important in improving their medical education and keeping up to date with current technology.
Okay. Dr. Ava, I thank you very much.
Thank you.
And wish you all the best.
Thank you.